This video is for information only and is not a substitute for professional medical advice. Always speak to your GP or a pharmacist before making any decisions about your health. So you've probably been seeing CJC 1295, ipamorelin, and retatrutide mentioned online in fitness communities, wellness spaces, maybe even in your social media feed. And if you're wondering what these compounds actually are, whether they're safe, and whether they're even legal in the UK, you're in the right place. Let's break it down. These three compounds are synthetic peptides, short chains of amino acids that act on different hormonal pathways in the body. None of them are approved medicines in the UK. That's the starting point for everything else we're going to cover. CJC 1295 is a synthetic version of a hormone that signals your pituitary gland to release growth hormone. Some early phase studies have been carried out, but robust clinical evidence supporting its use for any conditions simply isn't there yet. It has no marketing authorisation from the MHRA. Ipamorelin works differently. It targets ghrelin receptors to stimulate growth hormone release through a separate pathway. It's often sold in combination with CJC 1295, with claims about muscle growth and fat loss. But those claims are not backed by large-scale human trials. The combination has not been validated by robust clinical evidence. Retatrutide is perhaps the most talked about right now. It's an investigational compound that targets three receptors at once: GLP-1, GIP, and glucagon, which is why it's sometimes called a triple agonist. Phase 2 trial data have shown significant effects on weight, and that's generating real scientific interest. But it remains unapproved by the MHRA and the European Medicines Agency. In the UK, retatrutide is only accessible within approved clinical trials. It is not available for private prescribing. Now let's talk about the risks, because this matters. When you source any of these peptides online or through unregulated channels, you have no way of verifying what you're actually getting. Unknown purity is a real concern. Inaccurate dosing is a real concern. Injection site infections are a real concern. And there's the risk of interactions with medicines you're already taking. These aren't theoretical. They're the direct consequence of using compounds that haven't gone through the regulatory process that licensed medicines must pass. On the legal side, outside regulated clinical trials and authorised routes, supplying these peptides for human use is unlawful under the Human Medicines Regulations 2012. CJC 1295 and ipamorelin are also prohibited under the WADA prohibited list, which is adopted by UK anti-doping. That list is updated annually, so if you compete in any regulated sport, check the current list and be aware that using these compounds could have serious consequences for your eligibility. So what are the safer options? If you're concerned about your weight, there are licensed, NICE recommended medicines worth discussing with your GP. Semaglutide, available as Wegovy, and orlistat have both been through rigorous clinical trials and are prescribed through proper healthcare pathways. If you're worried about growth hormone levels specifically, the right route is a referral to NHS endocrinology. A specialist can assess whether a deficiency is actually present and discuss appropriate regulated treatment if needed. Please don't self-diagnose or self-treat based on what you've read online. Speak to your GP or a pharmacist, someone who can look at your full medical history and guide you properly. And if you're currently using any of these peptides and you experience unexpected symptoms, whether that's changes at an injection site, unusual hormonal symptoms, or anything else that concerns you, contact a healthcare professional promptly. To recap, CJC 1295, ipamorelin, and retatrutide are unapproved synthetic peptides with no licensed use in the UK. Sourcing them online carries real risks around purity, dosing, infection, and drug interactions. And there are safer, evidence-based alternatives available through proper healthcare channels, so please have that conversation with your GP or pharmacist. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. Like this video and subscribe to the Bolt Pharmacy channel for more straightforward, medically grounded health information. We'll see you in the next one.